Hi, well, welcome to this COVID-19 special Encephalitis podcast by the Encephalitis Society. We've taken many of your questions, and over the next hour we plan to answer as many as possible. We just want to reassure any viewers as well that the Encephalitis Society services remain largely unaffected by this recent outbreak, and so if you need any support or information, our teams remain at your service. Go to encephalitis.info for contact details or to chat online. I'm very grateful to have two very eminent specialists joining me today, Professor Tom Solomon and Dr. Lance Turtle. Tom, Lance, perhaps you'd like to say a few words about your specialist areas and where you work, along with any involvement that you've had in the COVID-19 outbreak so far.
Thanks, Ava. So I'm consultant in infectious diseases in Liverpool. So I'm on the front line of this, as our unit is one of the high-level isolation units for the UK. So we took some of the first patients with this condition. And through the Health Protection Research Unit in emerging and zoonotic infections, I'm also very heavily involved in the research response to this. So I'm both looking after patients and doing research on COVID-19.
Thanks, Lance.
Thanks, and I'm Tom Solomon. I'm based in Liverpool as well, at the University of Liverpool and the National Institute for Health Research, Health Protection Research Unit in Emerging and Zoonotic Infections, where I'm the director. So our Emerging Infections Research Unit exists to support Public Health England in protecting the UK from emerging infections. It's a collaboration between the University of Liverpool, University of Oxford, Liverpool School of Tropical Medicine and Public Health England. And so we responded very rapidly once it became clear that there was this new emerging virus causing COVID-19. And we're supporting research, a collaboration really of many hospitals across the country who are recruiting patients into the study so that we can understand the disease a bit better. We're collecting samples to improve the diagnostics. We are also collecting samples to understand the disease mechanisms a bit better. And Lance and many others are working to support these efforts.
Thanks both so much for taking the time to join us today. We've got quite a few questions from around the world, so I'm going to jump straight in with the first question, which is COVID-19 is a coronavirus, but what is that and why is this spreading so much faster than other everyday viruses that cause coughs and colds?
So COVID-19 is a disease which is caused by a novel coronavirus. So coronaviruses are a family of viruses which get their name because they look a bit like a crown when you take a greatly magnified picture of them. So the reason this disease is spreading so fast is because it's a new virus in humans, and so no one's got any immunity at all, so nobody's seen it before. So that's why it's really important that everyone should do things like wash their hands many times a day, avoid unnecessary social contact, avoid unnecessary travel. So those are key things which can help the spread of the virus. It is spreading faster than common coughs and colds, but it's actually not that much faster. Common coughs and colds also do spread quite fast, actually. And in fact, there are other coughs and colds caused by other coronaviruses that have been in the human population for a long time before this coronavirus. But they cause very, very mild disease. So you don't notice it in the same way that you notice this virus, which in a small number of people can have very serious effects.
Thank you. Well, our next question was, our family is affected by encephalitis at the moment, and we need to go to our local hospital for further tests. However, that hospital has cases of coronavirus there. Should we still attend?
So people in that position should follow the advice and guidance that's given by their local hospital, and all local hospitals will be contacting patients and telling them what they should do in different circumstances. So if, for example, someone is acutely unwell with encephalitis, then they must go to hospital. That's an emergency and they need urgent treatment. If, on the other hand, they have had encephalitis in the past and they are due for an outpatient appointment, perhaps as follow-up from that illness, then that might not be quite so important, and that might be something that you can cancel or defer. But again, the local hospital should be giving you guidance as to what to do with that. If you have encephalitis and you're having ongoing treatment, which is needed to keep the encephalitis under control, then you should be attending for that. And hospitals have infection control policies in place which will limit the spread within the hospital, and so they should be able to tell you which areas are safe for you to go to, and that will be fine. And the fact is, there's now this virus is now spreading within the community, so actually it would be hard to avoid it, and just not going to hospital would not be enough to avoid the virus completely. So the best things you can do, if you're unwell, stay at home for 7 days or 14 days if there's an illness in the family. Wash your hands throughout the day as many times as possible. Practice social distancing. Stay at least 2 meters away from people and avoid unnecessary contact and unnecessary travel.
Thank you. Well, our next questioner said, I had viral encephalitis in the past. Am I more likely to catch COVID-19 or be at risk if I do catch it?
I think that's an easy one to answer. There's no reason to believe that somebody who's had viral encephalitis in the past and has now got over it is at any more risk of either catching this infection or being at risk of severe disease if they do. So I think we can be reassuring to people there.
Okay, and that's specifically around viral encephalitis. Yeah. Thank you. So the next question said, my daughter was 9 months old when she had a herpes simplex viral encephalitis. She's now 6 and still on medication for epilepsy, as well as a daily dose of antivirals to keep recurring cold sores at bay. She also had pneumonia 1.5 years ago. Is she more at risk from COVID-19 than a child without prior health problems?
Thanks. Well, I think there's a couple of issues to consider there. So it sounds like this is a family that's had a tough time, clearly. And she's now currently on medicine for epilepsy and also antivirals to keep the cold sores at bay. But in terms of risk factors for COVID-19, we know that people at risk are those that have chronic ill health. And we also know that people at risk are the elderly. And in fact, children seem to be less likely to get severe infection. So we have to then think about this. Here's a 6-year-old who has had infections. She's had pneumonia a 1.5 years ago, but she's relatively well at the moment. So she's somewhere in between. The fact that she's young would make me less concerned. And in fact, the chronic conditions that she's had are not those that have been recognized as being associated with severe infection. So those conditions are things like high blood pressure or chronic lung problems. She's had pneumonia just once 1.5 years ago. So I think I would probably be encouraging overall, but I'd be interested to hear whether Lance has a different perspective on that.
No, I would tend to agree with that. I mean, unless that there is some underlying predisposition to infection, then otherwise she would be the same as the rest of the population. Having had pneumonia once, as far as we know, is not a risk factor for getting worse disease with COVID-19, unlike things like diabetes, high blood pressure, etc. So no, my suspicion is that she would be at no greater risk than the rest of the population. And of course, being age 6, that risk is extremely low. I mean, the number of cases, thankfully, that we've seen in young children less than 10, has been very, very little compared with the number of cases in other age groups.
Thank you. I'm sure the family will find some reassurance in that, and the many similar families who have similar situations. So does encephalitis fall under the underlying medical condition that experts talk about? Does it mean I'm in the vulnerable persons category? I'm not sure how careful people who have had encephalitis need to be.
So the answer to that is it depends. So like Tom said earlier, if you've had encephalitis, which usually is an acute infection, then that means that illness should resolve. And after that, if you recover, then there's no reason to think that you're any different risk from COVID-19 after that. The same goes for autoimmune encephalitis. If you've had that and you've been treated and you've recovered, then again, there should be no increase in risk. The one exception to that is somebody who would be under ongoing treatment for autoimmune encephalitis with treatment that might suppress the immune system. And I see that some of your other questioners have also brought this point up. So if your immune system is suppressed, then under those circumstances, then we would expect you to be at increased risk of COVID-19. Exactly how much increased risk I can't say, but I would suggest that anyone who is in that category, who's undergoing active treatment with immune suppression for autoimmune encephalitis or any other autoimmune disease, or cancer treatment, for example, that they should take additional precautions. They should regard themselves as being in an at-risk group, and they may want to consider following the government's advice of self-isolation at home, and they should also follow the same measures that I've outlined already: washing hands, social distancing, etc.
Thank you. Can you get encephalitis from COVID-19? We recently read of a patient in China whose CSF, or cerebrospinal fluid, had tested positive for COVID-19. Does that mean that he had encephalitis?
So that's a very good question. So I haven't seen that specific case, so I can't comment on that without knowing more of the details. What I can say is that there have been a large number of cases in China. We have quite good information on many of those cases, and there is not very much in the way of disease of the brain or symptoms that might be associated with disease of the brain reported. Now, many viruses cause mostly non-brain disease, non-encephalitis. They cause something else, and they occasionally get into the brain. So, of course, it is plausible that this virus could get into the brain, but at the moment, I have not seen any convincing evidence that it actually does.
Thank you. So the next question is, given it's possible to contract autoimmune types of encephalitis after surviving some viral types of encephalitis, does this risk increase if infected by the COVID-19 virus?
Yeah, well, we know that after, for example, herpes simplex virus encephalitis, there is, in a small number of patients, a risk that they will recover from that, and then they'll go on and get autoimmune encephalitis caused by NMDA antibodies or associated with it. But there's no evidence at all that somebody who's had COVID-19, not causing encephalitis, but just a COVID-19 illness, will get an autoimmune encephalitis. There's nothing to suggest that at all. And we've seen, now many thousands of patients, sadly, with COVID-19 infection in China. And there's been a little bit of neurological disease acutely, as Lance mentioned, but there's not been any evidence of people who recovered from COVID-19 and then developed an autoimmune encephalitis. But it's a space that we will keep watching, I guess. Thank you.
Some of our members have children who have had autoimmune encephalitis. They've received lots of immunotherapy, such as steroids, IVIG, plasma exchange, and in some cases, second-line treatments like rituximab. Are they at greater risk of COVID-19, and what precautions should they take?
So somebody like that who is on active immunosuppressive treatment at the moment, they are the sorts of people that we do need to be especially careful about. And that's really why we have all these measures, the social distancing measures, etc., etc. We know that at least 99% of people who get this infection will recover. It may well be more like 99.9% of people will recover. But there is a small proportion who get severe disease, and that's the elderly and those who have chronic illness, and in particular immunosuppression is a risk factor. So what precautions do they need to take? Well, these are people who should be very careful now about being in self-isolation at home, keeping away from anyone who might be ill. So they shouldn't go out at all. And then the other issue becomes, well, what if a family member has become unwell? And unwell just means a cough in this context, but we know that a new cough or a fever could be a sign that this is somebody with COVID-19. So the advice is that if somebody in the family develops a condition like that, they should try, if at all possible, to go and stay somewhere else. We really need to protect people who have a risk of getting severe disease.
I think the questioner in that case also was, if I remember, their immunosuppression treatment had happened some time ago. So I think there's some confusion in people's minds. They don't know if that means that they still have immune systems that are of concern.
Okay. Well, so clearly, if they're actively being immunosuppressed now, they need to follow that guidance I've suggested. It depends what we mean by a long time ago. I mean, if somebody had these treatments many years ago, their immune system has probably recovered. And I suppose a guide might be that if you are the sort of person, you know, if it was maybe more recently, a couple of months ago, then you should be more careful. Okay. And it might be if you're finding you're getting every cough and cold that goes round, that's a suggestion that maybe you are slightly more vulnerable. But Lance might like to comment on how long it takes for the immune system to recover after these types of therapies.
Yeah, so that it's a good question. That it's quite variable. It will depend on exactly what the treatment was, and it will vary between individual to individual. Generally, with the kind of treatment that's mentioned here, so steroids, which are a sort of broad immunosuppressant drug, and they mentioned rituximab, which is a special antibody treatment which targets the certain cells that make antibodies in the blood and protect you against a wide range of different things. So most people recover from those after a few months. So if it was anything more than sort of 3 to 6 months ago, then the risk is going to be lower. But I mean, the sort of short answer is the closer to the immune suppression you are, the greater the risk will be. And that risk will gradually decrease as time from immune suppression goes on.
Well, that's really helpful. Thank you. Some people are also concerned that during and or post-treatment for autoimmune encephalitis, that they have depleted B cells. What does this mean for catching COVID-19, and is there anything that they should do?
So this is actually very similar to the last question. So this drug rituximab, which your last questioner mentioned, that's the drug which depletes B cells, and B cells are the cells which turn into antibody-making cells, which protect you against a wide range of different things. So again, it's similar to the answer to the last question. If you've just had rituximab or a similar treatment that is aimed at knocking out your B cells in order to treat your autoimmune encephalitis, if you had that 2 weeks ago or 3 weeks ago, then your immune system will be lower than that of a healthy person who hasn't had that treatment. But if it was 4 or 5 months ago, the effect will be much less. If it was a year or two ago, then you can regard yourself as basically normal.
Thank you. For those who've made a full recovery from autoimmune encephalitis, I think we touched upon this earlier. The question was, are they still considered immune compromised and more vulnerable to COVID-19?
So that's a much easier question. The answer to that is no. So if you fully recovered and not on immune suppression, then you are the same as the general population.
Thank you. Another questioner said, my family member is still recovering from autoimmune encephalitis and is still receiving immunosuppressants. And again, I think you touched upon this a minute ago. And their specific question was, what are the risks to them in this current outbreak, and what precautions should we be taking as we're frightened that we're a risk to them?
Thank you. I did touch on that earlier, and it is an important question. The risks to them are that they might become infected with this virus from someone in the family or somebody outside. And because they're on immunosuppression, they're more likely to get severe infection. It's worth saying, though, that when we say severe infection, that might mean that they need to go into hospital. And of course, at the moment, the vast majority of people who get this infection don't need to go into hospital at all. So, we don't want this to be too frightening. By severe infection, we're meaning somebody that might need to go into hospital. They might need special support in terms of fluid if they're not drinking well. They might need to go on oxygen. So, there's lots of support available in hospital. The precautions to take are for them to be isolated as far as they can, and for their contacts, so they're not going out at all. I mean, that's absolutely clear now. They should not be going out, except to go in the garden to get some fresh air. And then within the house, as long as the other family members are well, that's okay. But if any of the other family members get a cough or any suggestion of being unwell, then they have to keep away from this person who's immunosuppressed. And that really means at the first hint of something, go and stay with somebody else. Having said all that, this is going to be a long process. We're not talking about a week or two. This is going to go on for several months. And we have to remember that if somebody's been unwell, we don't want them to be stuck in a room somewhere at the back of the house and getting miserable. So we really have to look after our mental health as well as our physical health.
I think that's an important point. So the next questioner said, my daughter had an autoimmune encephalitis in October and now has a diagnosis of MOG antibody disorder. What is your advice?
So the advice in that situation, which is obviously significant and is concerning for that family, is very similar to what we've given to the last few questions around treatment for autoimmune encephalitis. MOG is another form of autoimmune encephalitis, basically. And if you're on immune suppression, then you're at greater risk. Whereas if the treatment's been some time ago and your immune system has recovered from that, then we don't expect you to be at increased risk. So it depends on what the ongoing treatment that is actually happening in that case is. So our advice is very similar to what Tom has just said. So wash your hands regularly, practice social distancing, avoid unnecessary contact and going out, etc. I think it's probably also worth at this point just saying a few words about what symptoms, what the typical symptoms of COVID-19 are, and what people should watch out for, in their own families, particularly among the family members who might be contacts of patients with autoimmune encephalitis who are undergoing treatment. So the typical symptoms are fever and a dry cough. So those are the commonest symptoms. The other common symptoms include feeling breathlessness or tightness in the chest, and then the sort of systemic symptoms you get with virus infections are also common. So aching of the muscles and fatigue, feeling like you have a flu-like illness. And most people are familiar with that. And in some studies where this has been examined, most patients have more than one symptom as well. So you don't have only a cough and nothing else, or only feeling tired and nothing else. It's usually a constellation. It's usually a combination of different symptoms. But basically, if you have a new continuous cough or a high fever, those are the cardinal symptoms, then that means you should separate that person from the person who's undergoing autoimmune encephalitis treatment and has a suppressed immune system by some way. And that could be putting one of those people in a separate room, or it could be staying with somebody else, or, there's a number of different ways in which that could be done. And there's good advice on the gov.uk website about how to do home isolation and social distancing.
What other websites would you suggest this is going to be viewed from people around the world? What other websites can people go to for that type of information?
That's a good question. I have not done a comprehensive look at that, I'm afraid. Most countries will have a government agency which is responsible for giving public health advice. Right. And I would say that should be the first port of call for people in that particular region. In the UK, that's Public Health England, which is on the gov.uk website.
Tom, are there any websites that you would recommend?
Well, so certainly in the UK, we look at the Public Health England Department of Health website, and each country will have its own web guidance coming from their own public health authorities. I think it's fair to say that different countries are at different stages in the evolution of this disease. So what applies in the UK will not necessarily apply in other parts of the world. But having said that, advice on basic precautions like how to wash your hands, on respiratory hygiene, etc., that's pretty standard. And so in a country, particularly in Latin America, where they are behind the curve in terms of this disease, it started in China, and then in Europe we're now had a growing curve. Latin America is not so far advanced yet, and I think their website similarly will be a little bit behind, and people there could look at the Public Health England website for guidance on those measures. But in terms of things like social distancing and other practices, it depends very much where you are up to in your outbreak, and that's why local information is more important. There is more general information on the World Health Organization website as well, of course.
Thank you. So moving into our last few questions, my daughter is 4 years post-diagnosis, this questioner wrote, and has been off rituximab and steroids for a year. However, she is currently taking Imuran, doesn't have any B cells, and is on IV IG. What is her risk, and is her immune system able to handle something of this nature?
So Imuran is a drug called azathioprine. So that is a form of immune suppression. So this is somebody who is immune suppressed in that case. It's worth noting that azathioprine is a relatively mild form of immune suppression. And actually the risk of serious infections in patients taking azathioprine is not all that much higher than the background population. But then there's a comment about not having any B cells. So again, if this person had rituximab more than a year ago, I would have expected their B cells to return. So I don't know if there's something else that's happened there, or some other treatment has been given, or that's part of the disorder perhaps. But that does place that individual at greater risk. On the other hand, that person is being treated with IVIG. So that's giving antibodies from other people. So that's replacing a bit the function of the missing B cells. So it's perhaps not as bad as all that. Nevertheless, I would say her risk is increased compared with the background population. And I would say that she should follow the same advice that we have already given in answers to other similar questions.
Thank you. So this questioner said, I've read that the government, and I think this person was from the UK, are now saying that increased risk from severe illness from the virus includes chronic neurological conditions. Would this include viral or autoimmune encephalitis?
Yes, the person who sent this in is right that the UK did issue new guidance on the 20th of March, which is just a few days ago, on details of who is considered to be at risk because of increased age, etc., other chronic diseases. And they do mention chronic neurological conditions such as Parkinson's disease, motor neuron disease, multiple sclerosis, a learning disability, or cerebral palsy. So the question here really is that's what it says on the website. Now, chronic neurological conditions, viral or autoimmune encephalitis is not mentioned specifically. And so I think it's a matter of judgment here. And I think if somebody has had those diseases and has made a good recovery, then they don't really fall into the category of being at risk. But if they have not had a full neurological recovery, then they should consider themselves in that group, even though they're not named specifically.
Okay, thank you. If I get COVID-19, what medications should I take? And is there anything else you can suggest to help get through it?
There's no antivirus treatment yet for the virus that causes COVID-19. So it's really what we call symptomatic treatment to get you through the non-specific features, which is primarily fever and cough and aching muscles. The cough, we don't really have anything that helps specifically with that, but fever and aching muscles can be helped. And it's the kind of tablets that you would take for any other flu-like illness, except, I would start with paracetamol because we know that's safe and it works fine. There's been some suggestion, you may have seen it in the last few days, about whether ibuprofen is okay to take or not, because ibuprofen is sometimes associated with bad side effects with people who have chronic lung conditions. So at this stage, it's, to be honest, it's slightly messy, the data that's out there, as it's an evolving situation and there's conflicting opinions. Therefore, I would start with paracetamol, but I would certainly say that somebody who's taken ibuprofen should not worry. And similarly, if people are taking it for other medical conditions, then we know they're benefiting definitely in those medical conditions. Whereas the story around ibuprofen and COVID-19, it may all turn out to be nothing. I think most people think it will turn out to be nothing. So I would probably not worry too much about that. I don't know, Lance, if you've caught up with more recent literature than I may have.
Yeah, I'm certainly aware of the story, and the idea here is that ibuprofen is actually doing something specifically bad in COVID, and that it might cause the receptor for the virus to be increased and make you more susceptible to disease or more susceptible to bad disease. And I think that is only an idea. There's no evidence at all that's actually true. I think that particularly in younger, healthier people who want to take ibuprofen or other drugs of the same class, that would include aspirin, Voltarol, diclofenac, naproxen. It's a class of drugs called non-steroidal anti-inflammatory drugs. These are very, very commonly used, commonly taken drugs by lots of people, particularly for arthritis and other sporting injuries and things like that. And for that, they're absolutely fine. And I don't think those people have anything to worry about. I don't think there's any risk, particularly in that group. The one thing I would say about those drugs is that particularly in older people, and particularly in people who are sufficiently unwell to be hospitalized, they do have some quite significant side effects. And we don't use them in hospital practice at all, really, because we're looking after mostly an older population who've got multiple other medical problems often, and they can have very significant side effects, particularly on the kidney, and they can cause bleeding from the stomach, at least in some people. So if somebody is of an older age, and particularly if they're on other blood pressure medications, I would encourage them to avoid taking drugs like ibuprofen for any severe acute illness, not just COVID-19. So if they fell ill with flu or they developed pneumonia, again, those drugs can be dangerous in that specific subgroup of people. And there may well be information that comes out that people who get very sick with COVID and need to go into hospital do get bad side effects from non-steroidal anti-inflammatory drugs. And that's because they're very sick patients with pneumonia, just like any other kind of pneumonia. I don't think there's going to turn out to be a specific relationship between COVID-19 and non-steroidals beyond that of any other severe acute illness.
Thank you. A sneaky question from me. Do we need a vaccine for COVID-19? And if we do, how far away from seeing a vaccine that can be used in human population do you think we are?
Yes, we do need a vaccine. How far away are we? There are already vaccines that have gone into the earliest phases of trials. There's one in particular in America that started recently. And this has been incredibly quick. It's now 80 days since this virus was first described causing a problem in patients in Wuhan in China, and to have a vaccine going into phase 1 trials within 80 days is incredible. But vaccines take a long time to make. So a phase 1 trial is just saying, can we give it to healthy people and will it not cause any harm in them? And those are the studies that are starting in America. After that, there are subsequent phase 2 and phase 3 trials. And these take longer because you have to allow time to see whether they have caused an immune response, which might be protective for the patients. But ultimately, these are large studies that take many, many months to do. And even if we complete the final study that shows, yes, we do have a vaccine that works, you then have to scale it up, which also takes a long, long time. So if everything went as fast as it could do, it's likely that the first vaccine available widely would be in somewhere between 1 year and 18 months. Which means that we're not going to have a quick answer from vaccines. People are working on a whole range of vaccines around the country for COVID-19 and for other viruses. And Lance is actually leading a vaccine development group in Liverpool. So I don't know if you have anything to add, Lance.
Not really beyond that, no. I mean, I think that we still have quite a bit to learn about the virus and about the infection in humans, and exactly what immunity looks like with this virus in the human population, given that it's a new virus. So the other kind of common cold coronaviruses that are already in the human population, people do develop immunity to, but the viruses change. There are several different types of virus, and so you can be reinfected with the same virus, basically. So we don't know what's going to happen with this virus in the population. Is it going to stay as one virus and we're going to get herd immunity, and then it's going to become in the future, it'll be a trivial infection in children where they get almost nothing, and then the adults are all immune? That's one possibility. Or is it something which is going to change and then keep coming back as a bit like flu does, where you get a slightly different virus coming every few years, is another possibility. So maybe one vaccine will do the job. Maybe we'll need more than one vaccine. Maybe we'll need to remake vaccines every few years, and we just don't know the answer to that yet.
Thank you. Is there anything else that either of you would like to add or share before I say a few words of conclusion?
Wash your hands.
Yeah, I was going to say exactly that. We've had a long discussion when we've covered important points, but people should remember the single most important thing they can do is wash their hands properly and wash them often. And if they do have a cough or a cold, be very careful to catch that in a tissue and dispose of the tissue and then wash their hands, because that is the best way to protect our loved ones.
There's a very good story in the New York Times of an example of that, of a school in Beijing that stayed open during the SARS epidemic. And they did very, very diligent hand hygiene and very simple things like keeping people off school if they were unwell, measuring temperatures and sending children back home. And the teachers led hand washing, and they just did very simple, basic things. And not only were there no cases of SARS in the school, they had the best attendance record that they had ever had, because nobody got anything. Nobody got any ordinary coughs and colds or flu or gastroenteritis or anything like that, just because they did really simple things really, really well. It's amazing how much we can't wash our hands, but actually, if we just do those really basic things, we can protect ourselves and our loved ones really effectively.
Wow. Well, that feels like a good message for us to end. We've covered an awful lot of questions there. We're deeply grateful to you both for taking time out of what we know is probably one of the busiest times of your careers. On behalf of all of our members, please accept our grateful thanks for all that you do, along with all the rest of our scientific advisory committee. Please stay safe, and if anyone has any further questions, please contact the support team at encephalitis.info. So thanks very much, everybody, and stay safe.